Immunity, and there's nothing new to talk about because I think anyone and everyone is just talking about it. But then, all of a sudden, immunity has taken a center stage into our lives. We always took immunity as granted. It was left over to children and geriatrics as if everyone in between was like super hale and hearty and healthy. And I think we were waiting for COVID to come and tell us that, just do the reality check where we stand today. And now what has happened is that everyone in the entire age group is running and rushing to pick up products, formulations available in the market, or anything that in their knowledge addresses immunity. And this has gone a kind of a little crazy and overwhelming. On one side, we see products, like I saw recently an ice cream making a claim because an ice cream is having some ingredient that's got to do with immunity. All of a sudden, they have bread, a breakfast bread, making a claim because they're putting some ingredient into it. So it's kind of getting right from there to the advanced, the pharmaceuticals world. They are rushing and creating the vaccines or the drugs. So there's a rush all around, right, from consumer for whatever they understand. And on the pharma side, of course, they have their own structural approach to the whole journey of coming up with the product. So that actually, what excited me to actually bring this session today is I got into actually studying, is there an established link between nutrition and immunity? And in my journey of trying to find the first establishment of the link to the journey today, it was quite surprising to me that it's not too old a learning. So it just goes back to 1950s when America was all about, it was witnessing the boom of Vitamania. But way down there in Guatemala Institute of Nutrition, there was this passionate nutrition expert, Dr. Nevin Scrimshaw. This guy was passionately experimenting with what would happen if you delete certain ingredients from the food to the animals and then subject them to various live and dead bacterial cells, what would happen. And the research continued to go on and on till 1959, when in America, the malnourishment meant protein, energy, malnourishment, and that could be addressed very easily. Those were the times when Dr. Nevin actually disrupted the entire science thinking by publishing his research work in American Journal of Medicine. And the disruption that he brought about, the message is that there's a very strong, intensive interaction, cyclical interaction between the immunity and nutrition. So the logic that he said, which sounds like no-brainer today, but it was a big thing at the time, is that malnourishment leads to compromised immunity. Compromised immunity leads to infection, susceptibility to infection, and infection in turn further drains out the nutrient resources in the body. So you could possibly say it as cyclical or say spiral. So it's a continuous interaction. Since then till now, the journey has gone on the same platform. Yes, we talk about human genome projects now, use of artificial intelligence to actually get into a personalized nutrition where people are talking about, I can actually pinpoint and say, hey, listen, you got to be on these ingredients that will keep your immune system strong and intact. But you know what? It's stuck in its own time of, sustainability and scalability. But in this journey, what has actually emerged well is the phytoextracts application into immunity and subjecting it to a strong clinical studies to establish the link. And this has been not only sustainable, but also scalable. And lots of new companies are actually getting into it, conducting a lot of clinical trials, and research are being published. That makes the entire story very interesting. So as for Nutrify India, we believe that now we are at the cusp of a major progress in immunity and nutraceuticals. And the good news is that we are clear, the industry is clear of the pathway. What is pending is the time frame and the momentum that is expected out of the industry. But the good thing is the journey has begun, and there are some leaders like market leaders, like, for example, Fuji Chemicals, who have spent years and years together on an ingredient. Discovery of an ingredient is one, proving it on a clinical trial is two, but passionately going into multiple clinical trial in different conditions, different races, is our dedication towards a responsible nutrition. That makes this subject very interesting. So while the focus would be on the immunity and nutrition and how do you take ingredient and get into the journey of commercialization, it's very important that we sit on a common denominator of responsible nutrition, which talks about the fingerprinting of ingredient, which talks about the clinical proofs, multiple clinical proofs, and the responsibility of applying the ingredient into the finished food or product or formulation format that would actually be well accepted by consumers. So that's important. Now, today we have a very interesting good mix. We have got an ingredient experts, a large formulation company, and myself would be integrating the learnings from market in India and other countries. I look forward to a very enriching conversation today and a very good learning. And to take this session forward, I'd love to invite the chairperson and moderator. Allow me to invite him, Mr. Krishnan Kumar Subramaniam. He is a celebrity actually by name KK. So I would from now on call him KK, and you guys can call him too. So KK is actually Vice President of Business Development in India, Middle East and Africa at a very large Indian multinational company, Glenmark Pharmaceuticals. In the past, he has been at leadership roles at various Indian and multinational companies and has worked on strategies, acquisition, mergers, and so on. But what is more interesting in the whole story is actually KK is a cricket fan, and he's a well-known radio cricket commentator. He's a sports anchor and a host too. So this makes it a very exciting combination, KK. And at this stage, I would like to invite the chairperson and moderator, KK, to take over from here, and then show is yours, KK.
Thank you, Amit. Thank you very much, and welcome to this.
Show is yours, KK.
Thank you, Amit. Thank you very much, and welcome to this excellent, pertinent webinar that has been weaved together by Nutrify India and Fuji. And it's indeed a great pleasure. Thank you very much to you, Amit, and to Nutrify India and to Fuji and all of you guys for inviting me here to chair as well as moderate this entire webinar. It's my privilege. It's a very special privilege. And also, I think personally, I believe that you couldn't have picked up a better subject as the subject of today's discussion. That's immunity. I like the word you use. COVID-19 has probably been a reality check. Immunity has always been a very important aspect for everybody, but was it given the due importance? Maybe COVID-19 has been a reality check in that sense, to use your words, and said, guys, give it the due importance. We always knew that it's something that one has to take care of. And, suddenly, in the last 6 months or so, everybody's talking about immunity. Even the average man knows which are the commonly used ingredients for immunity, which are the common ones that need to be taken. And it's not uncommon to go out for you yourself or your family, you want to go and purchase, and somebody tells you that it's not available. Not available. Something which was always available at the drop of a hat suddenly is not available. Why? Because there's an awareness and a realization of immunity. And with medical media, with authentic medical media, and with several other channels, including also social media, there's so much being talked about immunity these days that I think it's very, very pertinent that we have this discussion, as you said, an interaction and a discussion on this webinar on immunity. I liked the introduction talking about nutraceuticals and immunity. We've known for a long time that both of them are interlinked. And I think somewhere today, one of the objectives that we will try to focus on and try and realize would be to bring nutraceuticals and ingredients and finished formulations together under the umbrella of good medical concepts, good medical clinical trials, and also from a scientific platform, which are the ones that we can really take forward. And given that kind of a background, I think it's logical to move on to the next stage of this webinar, and that provides a logical sequel for me to introduce our main speaker for the day, Dr. Joerg Schnakenberg. And ladies and gentlemen, Joerg, there he is, Joerg, the erudite handsome man. Yeah, Joerg, welcome.
And hello, everybody. And thank you, KK, for your kind introduction. It's really
just to continue and say a couple more things. There are so many interesting things about you, Joerg. But ladies and gentlemen, Joerg studied chemistry at the Philipps University in Germany, obtained a doctorate in biochemistry in 1993, and his first 3 years were spent in marine biotechnology in Kamiyashi, Japan. He also spent a full year working with Dr. Robert Huber at the Max Planck Institute of Biochemistry in Germany. And I must say that would have enriched him a lot, because all of us know how big and how very famous and important is the Max Planck Institute for Biochemistry. And Joerg was associated with them. He was the Humboldt Fellow with Tsukuba, Japan. In 2000, he joined Hitachi Life Sciences as what? As the head of genotyping facility. And if that were not enough, he was in charge of promoting a new and innovative brainstorming technology product at Hitachi Medical Company later on. And since 2017, Joerg has been associated with Astareal and Fuji, and is heading there and is heading in a very leadership role as technical marketing manager of scientific affairs in Astareal and Fuji. So, ladies and gentlemen, it's a privilege to introduce a man who started off in chemistry, went on to a doctorate in biochemistry, went on to marine biotechnology, and at the other end of the value chain, went on to head of commercial genotyping, and then finally, brain scanning. I'm not too sure whether you've got anything to scan any of our brains over here, Joerg, but certainly over the next half an hour or so, we're going to hear you and try and scan your brain on immunity and what you have to share with us on the immunity front and the latest developments and your thought processes and suggestions on how to take this immunity platform forward. As we said earlier, immunity today is recognized more than at any time in the past as a very, very important, pertinent subject, not just to be attended to, but to be given importance to be implemented on a day-to-day basis by the average man, because that's going to be a key around which, the fulcrum around which a lot of our day-to-day activities and even medicine and medical science could well revolve over the next few years. With that, Joerg, it's all yours. Take it away.
Thank you very much. It was a very kind introduction of me, and you embarrassed me a little bit with all the stations I went through my career. It's really a great honor being here right now and talking to you. And I would like to welcome all you guys out there who spared time today and to join us at our little webinar, where I intend to take you on a journey revisiting, for obvious reasons, the importance of the immune system, how important nutra-ingredients are to maintain our immune system, and particularly the special role natural astaxanthin can take to keep our immune system strong and healthy. Let me share my screen with you and start my presentation. As Amit already said in the beginning, we tend to take our immune system and good immune health for granted. But the recent developments, especially globally, have put immune health and maintaining a good immune health in a new spotlight. And I can imagine that many out there are now thriving to look at new possibilities to enhance our immune health, to create new products which can provide us with a better support of the human immune system. But before I go into the more details and especially talk about the role natural astaxanthin can play, let me provide a short refresher of the immune system, what it is, how it works, and let me introduce the main players in the immune system on which natural astaxanthin has a beneficial influence. Why is it not working? My screen froze. Okay. So the immune system, what we always take for granted, is actually a very complex system. And what we very often neglect is that the very first line of defense against pathogens like bacteria, viruses, microbes, fungi, and so on, these are physical barriers. It is our skin. It is the mucous lining in our respiratory tract and in our intestines, which keep quite a few pathogens and harmful invaders at bay. But once these barriers are being crossed by bacteria or viruses, then what we commonly call the immune system sets in. And this immune system is a very complex system. It is a complicated network of immune cells, white blood cells, and organs that are producing these immune cells. And all of them work closely together to protect our body against invading pathogens. Let's say a virus or a bacteria has crossed the outer physical barriers and has invaded our system. The internal immune system sets in, and in first very quick but rather unspecific defense reaction by the innate immune system, immune cells will try to take care of this invader, neutralize it, and destroy it. If this shouldn't be enough, then the second stage of the internal immune system sets in, and this is the adaptive immune system. This is a much more complicated system. The development or the maturation of the adaptive immune system takes a couple of days to really become fully functional, because several developmental steps are involved here. So if we compare the innate and the immune and the adaptive immune system, I would like to point out the major players here. For example, when we are looking at the innate immune system, the major players here in this quick and unspecific response are macrophages or neutrophils, which are characterized by their capacity to attack pathogens, engulf them, and simply destroy them by digestion. But if this first internal immune reaction is not specific enough, the second step of the immune system will set in, and this is the adaptive immune system. And there, complex processes are taking place. I don't want to go into details, but there we have two types of white blood cells which are crucial for the adaptive immune system. And these are T cells. They are responsible for attacking and actually then neutralizing and destroying intruding pathogens. And then we have a B cell. And the special characteristic of B cells is they are responsible for the development of a long-lasting immunity. B cells are capable of recognizing antigens, so that means parts of a pathogen or even the entire pathogen. They start to develop antibodies, release these antibodies, and these antibodies work like basically they work like little flag. They recognize one specific pathogen. They set the flag on the surface of this pathogen, and T cells and also natural killer cells will recognize this signal, attack the intruder, and destroy it. So if we are looking at the global situation of the immune system, we have to realize that over the past couple of decades, we have noticed that the global immune health is declining. The reason for this basically have something to do with our lifestyle. So our lifestyle is getting more stressful. Also, our dietary habits are not the best, and we have to acknowledge that immune health pretty much depends on a healthy diet and the nutritions we are taking in. And one of these particular nutrients that can help us to maintain or to support immune health, this is natural astaxanthin. And in the following, I will show you evidence how natural astaxanthin can enhance the immune response by having beneficial effects on the key players in our immune system. The problem with diets and nutrients is that many nutrients we cannot consume in sufficient amounts through our daily diet. So, for example, if you are looking at astaxanthin is a well-known, very powerful antioxidant. We can find it in a variety of marine organisms, in lobster and salmon. But unfortunately, the concentration of astaxanthin is too low. So if you are looking, for example, at the Americans and salmon, in America, the average American consumes about 11 milligrams of astaxanthin in a year. But if we want to support our health, we need at least a dosage of 2 milligrams per day. If we wanted to support our body or provide our body with sufficient astaxanthin through a diet, this means we would have to eat about 12 servings of salmon every day. This is more than 500 grams. And I think it's clear that this is basically impossible. So we have to resort to supplementation. And this is where Astareal comes into play. We are utilizing a microalga called Haematococcus pluvialis. This is a microalga which, under stress conditions, produces large amounts of astaxanthin. And astaxanthin has been pioneering the technology in cultivating these algae and extracting the astaxanthin from these cells. So now you may ask, why astaxanthin? What is so special about astaxanthin? And there are numerous studies out there that have shown how that natural astaxanthin is a very strong antioxidant. Actually, it is in comparison to other natural antioxidants, the strongest antioxidants. It has exceptional quenching powers when it comes to free radicals, and it is also a very strong anti-inflammatory. But what makes astaxanthin really special lies within its molecular structure. So the astaxanthin molecule consists of two hydrophilic end caps, which are interconnected by a long chain of conjugated double bonds. And this particular molecular structure allows this molecule to integrate itself into membrane structures. So it can integrate itself into cell membranes, but also mitochondrial membranes. And in this way, it can protect a cell or mitochondria from reactive oxygen species and oxidative damage from the outside as well as from the inside. If you are looking at other natural antioxidants like beta-carotene or vitamin E, vitamin C, they can only protect the cell either within the lipophilic double layer or from the outside. But astaxanthin provides kind of full protection of the entire cell or the entire mitochondria. And with this, I come to the first study I would like to show you. This was one of the first studies to show that astaxanthin has a positive effect on human immune cells. In particular, this was a study where human neutrophils were placed under oxidative stress, and we can see, or what we can see is that despite the fact that oxidative stress is diminishing the immune capacity of these cells, in the presence of astaxanthin, we see a reversion of this effect. In this study, it could be shown that the phagocytic capacity of neutrophils was enhanced by astaxanthin, as well as the microbicidal capacity by about 30%. I think this is quite impressive data. Then soon after, a similar study was conducted with a combination of astaxanthin with vitamin C. And here we can see that when human neutrophils, again, are under oxidative stress, in the absence of astaxanthin, we see a drastic decrease in the phagocyte capacity. So that means the capability to attack and neutralize pathogens. But if the cells were provided with astaxanthin, there we can see a reversion of this effect. Astaxanthin is not only protecting the neutrophils from oxidative damage and the consequential diminishing of their immune powers, it is even increasing the capacity to tackle invading pathogens. And with this study, I would call this a groundbreaking study, because this was the first study done with humans. And there the research could show that astaxanthin has a very particular effect on the key elements of the adaptive immune system, on the T cells and the B cells. Here it could be shown that astaxanthin is promoting the proliferation of these cells. That means in the presence of astaxanthin, T cells and B cells are increasing. That means we have an increased or enhanced immune response. But astaxanthin was found to have also a very positive effect on natural killer cells. These is also one kind of white blood cells, which is responsible actually for the destruction of pathogens. And there it could be shown that astaxanthin is enhancing their cytotoxicity, so that their capability to destroy pathogens or to kill infected cells. So when we are talking about the immune system, we have been talking about T cells and the B cells. When we are we have recognized the importance of the B cells for long-lasting immunity. And we have to look at antibodies, immunoglobulins. And we all know that if we are under physical or mental chronic stress, this has a negative effect on our immune capacity. And here we have a study done with professional athletes. And here we can see that in the placebo group, that the participants are experiencing a decrease in the count of secretory immunoglobulin A molecules. However, if athletes are being supplemented with astaxanthin, there we can see that astaxanthin actually is increasing the count of immunoglobulin A, and thus enhancing the capacity of the immune system to recognize pathogens, viruses, or bacteria, and consequently destroy and eliminate them. So now you may say, okay, but not everybody is a professional bodybuilder or athletes. How about the standard, the normal people? There we have a very recent study done here in Japan, where participants were subjected to a simulated daily stress. So a mixture of physical stress and mental stress, just in the right strength to simulate a busy, stressful life. And here we could clearly see that this chronic stress causes a drastic decrease in immunoglobulin A. I mean, minus 37%. This is really drastic. But if these subjects were supplemented with astaxanthin, we can see that astaxanthin is preventing the decline of the immune health. It is basically keeping the count of antibodies constant. A little bit earlier, I have mentioned the importance of oxidative stress and reactive oxygen species. We know by now that many, maybe even most of human ailments are somehow connected to reactive oxygen species and oxidative stress, oxidative damage. And the particular role in this process play mitochondria. If we are looking at a healthy person, there is the mitochondria are responsible as the powerhouses of our cells to produce energy, and in a healthy cell, in this process of energy production, mitochondria also produce reactive oxygen species. However, if we are looking at a healthy cell, a healthy cell is capable to use its own internal antioxidant system to keep an excess of reactive oxygen species well balanced, and no harm and no damage is done. However, if the stress is increasing, for example, during sport, where mitochondria are required to produce even more energy, this will also lead to an increase of reactive oxygen species. And then very quickly, the balance gets unhinged, and an excess of reactive oxygen species starts to compromise mitochondria, the cell. It can reach to the stage where we observe mitochondrial dysfunction, and finally apoptosis. So it means the death of the cell. But astaxanthin has a very beneficial effect on mitochondria health, and it is doing this basically in two ways. So one way is astaxanthin was found to enhance or to stimulate the expression and release of PGC1 alpha. This is an enzyme which is involved in the regulation of the biogenesis of new mitochondria. Another factor is an enzyme called CPT1. This is an enzyme which is responsible for the transport of nutrients in form of long-chain fatty acids from the outside into the mitochondria, and in the mitochondria, then these fatty acids are being metabolized to form ATP. So here we have a study who gives evidence that astaxanthin is enhancing the expression and release of PGC1 as well as its isoform PGC1 beta, and this means the more PGC1 we have, the stronger or the higher the volume is in freshly made, healthy, well-functioning mitochondria. So I mentioned that what we need to generate energy is we need nutrients, and here we have this fat carrier or channeling molecule CPT1. And here in this study, it could be shown that the presence of astaxanthin or the supplementation with astaxanthin is increasing the rate of fat transport across the mitochondrial membrane. But especially CPT1, there's another interesting, exciting story about this molecule, because this molecule is a transmembrane molecule, so it depends on an intact membrane structure. Unfortunately, this enzyme is very sensitive to disturbances in its surroundings. So if I have oxidative damage, oxidative stress, which is compromising the membrane structure of a mitochondria, it will react immediately with a reduced capacity to transport fatty acids into the mitochondria. So that means our mitochondria are depleted of nutrients. They cannot produce enough energy anymore, and the decline of the mitochondria sets in. And here I like this very much, this study, because this shows us very clearly what oxidative stress is doing to mitochondria. As we may all know, in the process for the process of generating ATP, mitochondria depend on the transmembrane potential. And this transmembrane potential can only be sustained if I have an intact and uncompromised mitochondrial membrane. So here on the left side, there we see mitochondria that have been exposed to oxidative damage. And what we see here in blue, these are all mitochondria where the mitochondrial membrane is damaged to an extent that where the transmembrane potential collapses, and these mitochondria are not capable of producing energy anymore. But on the other hand, if you look at the right side, these are mitochondria that have been supplied with astaxanthin. And here we see almost no blue staining. This means all these mitochondria we see here in this image, they they are characterized by an intact membrane structure, which is capable of maintaining the transmembrane potential, allowing the mitochondria to efficiently produce energy. So another component of the immune system or immune health is we also have to talk about inflammation. Because what is inflammation? Actually, it's nothing else than a sign that our immune system is working. And in the beginning, I have mentioned that astaxanthin also has very strong anti-inflammatory properties. There are numerous studies out in vitro, in humans, in animals that have shown that astaxanthin downregulates the expression of inflammatory mediators of cytokines. In particular, the TNF-alpha or the interleukins 1, 6, and 8, or the inducible nitric oxide synthase. And this is done by astaxanthin suppressing the translocation of NF-kappa B, or better, or more correctly, a subunit of this huge protein. So, and here we have a human study where exactly this was investigated. What influence has astaxanthin on the expression and release of TNF-alpha? And here we can clearly see that the supplementation with astaxanthin for 3 months drastically reduces the amount of TNF-alpha. These results have been confirmed in yet another study. Here it could be shown that in neutrophils that have been exposed to oxidative stress, astaxanthin reduces the expression of interleukin 6, but also TNF-alpha. So here we see that astaxanthin has a really pronounced anti-inflammatory effect. I like this study very much because it gives us a clearer image, an idea how astaxanthin is preventing the expression of inflammatory mediators. Here we are looking at cells that have been exposed to high concentrations of glucose, which causes oxidative stress to the cells, and the cells will react with processing NF-kappa B to the point where a subunit is being translocated into the cell nucleus, where it binds to specific DNA sequences and initiates the expression and release of cytokines, inflammatory mediators. But if we are providing astaxanthin, there we can see that even in the presence of high concentrations of glucose, the translocation of NF-kappa B and accumulation of this protein in the nucleus can be prevented by astaxanthin. And this process is also dosage dependent. So there's a clear indication that astaxanthin has a strong effect on the expression of inflammatory mediators. And with this, I think I have covered. I have shown all the evidence in our main evidence that show how astaxanthin is supporting our immune system. So I have shown that astaxanthin enhances the neutrophil function. It stimulates the biogenesis of T cells and B cells, which are crucial in the adaptive immune response. I have shown data giving evidence to astaxanthin boosting natural killer cell cytotoxicity. It boosts the production and release of immunoglobulins, and it downregulates the expression and release of major inflammatory mediators. So what is the role Astareal plays in this whole research? I mean, Astareal has been dedicated to promoting, conducting research for decades. And actually, we have been looking at immune health and the effect of astaxanthin on the immune health for quite some time. Did a lot of research on this, and this resulted in getting 2 patents on Astareal, astaxanthin for immune health. In 2004, our first patent was granted for using astaxanthin to treat autoimmune diseases and chronic viral and bacterial infections. Then later in 2006, the second patent related to immune health was granted, and this was for using astaxanthin to inhibit the expression of inflammatory cytokines and chemokines. And here, these are the fruits of many years of research, and Astareal has been supporting research globally. We have conducted our studies by ourselves, and we are a strong supporter of any clinical studies. And as a result, astaxanthin is our astaxanthin has been used in many clinical studies, and therefore astaxanthin is also recognized as the world's most studied brand. And with this, you feel you can recognize I'm moving more towards market information. In the last part of my presentation, please let me talk a little bit about the market and immune health supporting products. So when we are looking at immune health products, we have to ask the question, what ingredients are being used in immune support products? And if we are going out into the market, look at products, we see a lot of multivitamin products in combination with minerals like zinc, copper, selenium, which are important cofactors for immune-related enzymes and the functioning of immune cells. But also, there are a lot of plant-based extracts being used that show antioxidant activities. I don't have to talk about curcumin, ginkgo biloba. We all know about their health benefits, but also fruit extracts are gaining more and more interest, like blueberries, blackcurrants, pomegranates, or green tea extracts. If we are looking into the market, are immune health supporting astaxanthin products available? Yes. Here I have assembled just 3 examples of immune health ingredients that contain Astareal astaxanthin. These are pure astaxanthin products. They contain between 2 and 12 milligrams of astaxanthin. But what we are observing recently is more and more a tendency to go out, look at immune health supporting ingredients and combining, so to speak, the best of them together. And we see more and more products released that combine multivitamin combinations with minerals, but also whole food antioxidants like curcumin, ginger, green tea, and astaxanthin. Here we have another set of examples, especially what we see on the right side. Again, we have a product which combines a whole series of vitamins, minerals, and again, whole food antioxidants like bacopa, ginkgo, maitake, and again, astaxanthin. So we see here a tendency that, that there is an increasing recognition of astaxanthin as a powerful antioxidant with immune health supporting activities, and there is a drive basically to take something good and make it better by adding the health benefits of astaxanthin. So if we are looking at the market development, especially over the past 5-6 years, then we have to realize that, yeah, there is a strong market growth there globally. In the past 5-6 years, globally there have been new products launches to the extent of more than 20,000 products. If we narrow this down and look at product launches of immune health products that contain astaxanthin, you see it follows the same tendency over the past 5 years. We have increase of almost 45%, a total of 324 products of products that target the immune health market. The same goes for the Asian market. Here we have to consider that the Asian market is always a little bit hesitant. They carefully look what is happening in Europe or in the USA. But if we are looking over the past 3 years, there we can observe that the launch of astaxanthin containing immune health products basically has tripled. And we are expecting these trends to go on and sustain for the next coming years. To summarize the market development we have been observing in the past years is we are seeing more and more interest in looking at immune supporting ingredients or products more in a wider range. Manufacturers are looking at different ingredients, picking the best ones and combining them with astaxanthin. And this has also an effect not only on the formulation. We see more and more interest in alternative formats, going away from the traditional soft gel capsule. People are experiencing what is called pill fatigue. They want to have more easily to ingest a product. They can consume on the go, either as a drink, as a drink, as a powder drink, as a gummy, or as a chewable. And with this, I would like to conclude my presentation. I would like to thank you very much for your interest, and I hope that you learned a few things from me. Thank you very much.
Thank you, Joerg. Thank you very much. That was really very, very comprehensive and beautifully covered, and across a spectrum of our audience, right from the basics of the innate the immune system, as well as the adaptive immune system, and how do they work, and then a logical transition to the healthy diet and nutrition, and particularly natural astaxanthin, 2 to 12 milligram. And very interesting that I noted over there, you said it's a stronger antioxidant than lycopene, lutein, beta-carotene, CoQ10, and vitamin C. And astaxanthin actually restores phagocyte capacity, and that is very interesting to know. And I like the amount of time you spent, and thank you very much for that from all of us over here. The mitochondrial aspect that you spent about, and you did mention certain important take-homes over there in terms of astaxanthin enhancing mitochondria biogenesis, fat utilization, fat metabolism, and preventing oxidative damage to mitochondria membranes. I think that was a very important aspect that you went through. To me, the factor you talked about, reduction in TNF alpha count by 43%, was arguably the biggest soundbite that you gave here today, and that was very, very important. And finally, winding up with the combination products of astaxanthin with vitamins and minerals and natural ingredients and across the board. A few thought processes that I might like to share, and as I take this session forward with Joerg and bring in Amit also over the next few minutes. Amit, would you like to just mention the email on which the audience over here might want to send their questions in, so that we can take as many questions as possible after my interaction with Joerg and you is done? Would you like to just come in for a moment and mention the email ID, please?
Yeah. So there are. Okay. So we have Varun from Sanjayota. So just to save time, what I could do is I've sent you the questions. Alternately, I can email it to you, and you can reply it. There's Varun from Sanjayota Nimandas. Varun at Sanjayota Nimandas, who has a question. And then, of course, so the question here is,
what we'll do is, we'll take those questions. I was just trying to check with you whether you might want people to send you the questions by an email ID. But if you're okay them sending it on the chat, it's fine. Okay, that's fine. You could probably summarize all the questions, and as you rightly said, we'll probably take a few of the questions from the audience as well. I might just want to start off with a couple of thought processes with Joerg. As I said, thank you very much for the comprehensive presentation. How do you see your immunity emerging in Asian markets like Japan and other Asian countries? You did touch upon that just about towards the fact bit of your presentation, but how do you see that emerging over the next few months and few years? And how does Fuji want to address it? And to what extent are you guys really looking at from a clinical trial window?
Yeah, I think immunity is like in the rest of the world is now a hot topic in Japan and Asia as well. I mean, we are likewise affected by the ongoing pandemic, and we are experiencing a renewed interest in immune health and in formulating new immune health supporting ingredients or products. That is clear, and actually we are in contact with a number of companies. Who are expressing their interest in adding Astareal's natural astaxanthin to their formulations, and it is one feature, one of our aims at Astareal is for us. A business is not done after we have sold our product. We also we try to help customers even afterwards. We give advice on what is the best ingredient for a particular formulation form or format, and we help also with the actual formulation of new recipes.
Also, do you find an increasing request for clinical trials on ingredients and nutraceuticals in this segment of immunity?
Yeah, I mean, first we are experiencing this increasing interest, and basically the second question is always from interested parties: show me the scientific evidence.
Yes,
and there it is very important that we have well-designed studies, done in humans that can clearly show clearly show evidence for the efficiency and efficacy of astaxanthin as an immune health supporting ingredient. And there we are very eager to support this kind of research and actively help researchers, also developers, gathering the right data and information.
Yeah, by talking of scientific evidence and clinical trials, one of our participants here has a very interesting question. He talks of what would you consider as the clinical biomarkers for immunity? I thought that's a very interesting question over here. That's why I brought it in at this stage. Joerg, would you like to comment on that?
Yeah. What I would do is, I mean, I have been talking about inflammation, and I hinted that inflammation basically is a sign for a functioning immune system. I think the easiest way or the fastest way to evaluate an immune response is looking at the inflammation. What inflammation markers are there? And then going a step further and see, okay, what is astaxanthin doing to these inflammation markers? Is it really suppressing them? Is it helping people to get rid of inflammation quickly? Yes or not?
Interesting, very interesting point over there. Now, if I may just move across to Amit over here. Amit, you've been in Nutrify, you've had a long history in nutraceuticals. How do you see the Asian markets, global markets, particularly the Asian markets, Southeast Asian markets, adopting the recent immunity trends? It was generally so far considered a generalistic subject. Now, as we talk to that, it's getting a lot more importance, and everybody's talking of building immunity. So how do you see this trend emerging?
KK, there's a difference between knowing and awareness. And current scenario is the best example. Let's look at some numbers. India, to begin with, immunity nutraceutical consumption has moved up to 25% now, up from 8% per annum, which was there in India. Now,
that's significant. That's significant.
Yeah, no, this is very interesting, which I'm going to share with you. Indonesia, it's 30% as recorded in the market research report, up from 12%. And the biggest is Philippines. It's 62%, up from 12 to 15%, KK. Now, it's important to see, I mean, I'm sure every country will have some fancy numbers, but what is more important here, KK, is that the sequential lockdowns, social media induced care is actually driving a daily practice into a habit. Okay, so what I foresee post-pandemic is that yes, there will be a trend which will be on the lower side for sure, because these big numbers will not stay for long. Post-COVID, the pandemic, the numbers will come down. But what is very important to note is, in a recent study that was published, it was evident that post-settlement, post-pandemic, the sale of immunity nutraceuticals will be 30% to 50% higher than what it used to be before the pandemic.
Okay. It does. These are aspects I didn't have the time to touch here, but astaxanthin has been found to manipulate a lot of natural pathways, especially in the inflammatory events, but because of the extent of the information available, so I didn't bring this information here into my presentation.
Now, you spoke about diet as a very important aspect to build immunity. Would you prescribe any standard dietary formats, Joerg?
Standard formats, dietary formats.
Yeah. Would you prescribe any standard dietary formats? that would be good from a point of view of boosting immunity?
Yes, what I would recommend, or what I would aiming for, is I would look at a combination a product where I selectively would pick vitamins that are proven to support immune health. Not to forget minerals. Zinc plays an important role in supporting and enhancing the immune health. And of course, I have to consider the antioxidant angle. And there, of course, my first short choice would be natural astaxanthin.
Very interesting. Yeah, zinc was a very important aspect. Yes, I think all of us certainly agree with you. If I may just go across to Amit for a minute, one talks about food fortifications, right? How do you see the future of food fortification with such kind of proven ingredients, Amit?
Food fortification has been there for quite some time. In fact, WHO has been deeply engaged in this activity. But KK, when you're talking of nutraceutical active ingredients with a claim and merging it with food format, then we're actually talking of functional foods. Now, functional food is an emerging area, and this is the future for sure. Although a lot of people get into aggressive debate with me on this. But here's something I wanted to share. A recent study which actually showed that 2/3 of American population has shifted its food habit in the last 5 years. And there has been a tendency to use a product with claims into their food formats. Now, let's get out of America for a moment. Let's come to India. There are 10 million established consumers who are consuming food and as well as functional food in their, the food requirement in their healthy food requirements. And then don't get carried away with 10 million people. There are 150 million people in India who are on an experimental mode right now, trying to get off from the unhealthy diet into the healthier world, experimenting, hitting it right, hitting it wrong. And then, so they would start fueling the 10 million existing population in India, and that will make India a real good market. But the largest right now is ASEAN countries with about 220 million people who believe in the functional foods and do consume in their food formats. So that's certainly the future for sure. And what I'm seeing is that most of the innovation in functional food is coming from the startup world and anywhere in the world, because I believe that the large companies are still stuck with the concept of incremental growth. You have a powder, you will make a bar out of it. That's the biggest innovation a large company would do. The startups are not held by incremental growth. So this is all about quantum growth. So they are coming up with innovative food formats using active ingredient and offering functional food. So I'm super excited with functional food, and it's the way to go forward.
Very, very positive. Yeah, I think that is the buzzword today. As you rightly said, in India also, one could see a quantum leap in this segment for sure over the next few years. I couldn't agree with you more. I'm tempted to continue with you, Amit, but I've just seen a very interesting question asked by one of our participants here on the chat. I'm going to straight away ask that to Joerg. This question had to come anyway, so let's straight away go to Joerg for that. Is there any documentation of astaxanthin alone or in combination as a prophylaxis for COVID-19?
No. I think this is with this we are really entering a dangerous terrain, in my opinion. First thing is, there's no study has ever been done with astaxanthin and COVID-19. And I think there are not many other ingredients used in such studies. So we cannot say that astaxanthin is a cure or a preventive ingredient for COVID-19. No, the only thing what we can say is, based on our scientific evidence, that we have that astaxanthin can help to maintain and keep our health, our immune system strong and healthy. But we cannot say we can go towards particular viruses or bacteria. There is no scientific evidence of it.
Very interesting. But then, yes, one of the things one is talking about is boosting immunity in these times. So from that perspective, it'll be good to go for astaxanthin, but may not be directly related to COVID-19. I think a point well taken. All right. Coming back to Amit, how does one see the attractiveness of such ingredients in the food industry?
See, let's understand the food industry works on a very specific format. The first focus of the food industry is indulgence. Okay, so that's non-negotiable. Indulgence. Second is the format. Third is the cost. These are mostly sacrosanct. Now, when you talk of putting up active ingredient with a claim, so when I talk to the industry, usually they say, okay, fine, it's interesting, but first they want to know what is the outcome, what is the claim that they can make in the food, what is the impact of the taste and experience once you add an ingredient into food format, and ultimately how much does it impact onto the cost of the end product. But you know, if an ingredient can address these questions, and as I said just now, that functional food is the way to go forward, it's a super good mix to get into it. But these are the criteria one ingredient has to really address. A lot of companies come with, sorry.
I think it brings us to the very important point that it's a mix and match of everything, right? It's not just, somebody working in a silo with one particular aspect. This is what one calls about fostering ideas together and mixing and matching, different things together, different segments together, different industries together.
It's a convergence of technologies.
That's the whole objective of it. Absolutely. Just one thing, Joerg spoke about a lot about clinical trials and the medical aspects and stuff like that. I want to ask you one thing. To what extent do you think there will be an OTC component in the segment of immunity as we move along? Amit, to what extent do you think? Amit, I said, Joerg spoke about the clinical trial part of it and the beneficial aspects from a medical point of view of astaxanthin in particular and immunity overall. I'm asking you a question, Amit, is how much do you see the OTC component coming through in the immunity segment over the next couple of years or so?
Okay. Very interesting. And before I answer this question, I did a little bit of homework to get an idea from what is OTC behaving into and what is the doctor's world. So Nutrify India has a separate chapter for medical doctors, KK, and there's some leading doctors. So we interviewed them and got an idea. And I would love to share that insight in this group to help a lot. So I foresee the RX and OTC evolving in their own channels. Of course, yes, it's obvious that the OTC will always take an upper trend because consumers' awareness, accessibility will always overtake. But what is more interesting is so we interviewed about 50 doctors, but these are trend makers, the key opinion leaders. And what we found is that they accept that there has been a 20% increase in the prescription of immunity supplements in their prescription. And they are proactively picking up patients who are susceptible to compromisation of immunity, like diabetes, and actually prescribing immunity products, which they didn't do before, And talking of, talking of the OTC, yes, obviously I just mentioned that India has grown 25% per annum on immunity product. Where is it happening? It's all in OTC. So yes, OTC is going to be big, but good news is that doctors too have picked up and is showing up on their prescription.
It's a confluence of both, isn't it? And that's why we started off by saying, if ever there was a pertinent subject today, it's immunity. Across the board, as we see, across the value chain, from OPC at the one end to the doctor's prescription, this is what is really enticing everybody, that this is the thing for today.
We were waiting for Uncle COVID to tell us that immunity is important.
Oh, there's a very important question from Vinayak Kulkarni. He wants to ask you a question. He says, what's the dosage recommendation for astaxanthin? What would you recommend? What's a therapeutic dose?
This is actually a very complex and maybe even difficult question. So at first we have to see, we have to make the difference between a supplement and the drug. In a supplement, the supplement is supposed to be taken over a longer period of time, giving the ingredients time to build up until they reach a biologically active level. It's not like a drug. You have symptoms. You take a drug and you immediately expect that the symptoms will fade away due to the drug. What we try to achieve with supplements is enhancing the body's power to deal with ailments by themselves. We try to prevent action of the disease on an ailment, and for this we have to keep a certain level of the active compound in the system. So when we come to the dosage, basically it makes no big difference if you are taking 2 milligrams of astaxanthin, for example, or 6 milligrams. The only difference is we have sufficient scientific evidence that the minimum dose effective dosage is 2 milligrams, and up to the upper limits you can go up to 12, 14, 16 milligrams. All have been proven to be safe for the participants or for the patients. But if we are using a lower dosage, it may take a little bit longer time until we see an effect. If you can see an health effect with 8 milligrams after a week, maybe with 2 milligrams you have to wait 2 or 3 weeks. The important thing here is that you are continuing to taking the astaxanthin to build up an effective concentration in our body.
We probably have about another 5 minutes, not more than that, to go. So I'll have a couple of questions. We'll take them. One of them is, how do you see, Joerg, this is to you, how do you see the regulatory pathway for immunity and immunity-based products? And how does one take that forward? And what kind of claims can one make? Can you throw some light on this entire aspect?
So if you are looking at the Asian market, so the regulatory status, it's difficult to describe. You see, Fuji Chemicals, we are selling astaxanthin in more than a dozen countries here in Asia and Southeast Asia, and to no surprise, the regulatory conditions are basically different in each country. If we compare this with other markets like the US or the European market, we even see that the Asian market is much more stringent than the US market. And for example, if I'm using associated health claim to a product like calling a product immune boost, I can do this in the USA, but in many Asian countries you cannot do this. But anyway, so we are very well aware of the diversity of the regulatory statuses in these countries, and as a consequence, we do everything what is possible to support our customers. We work closely together with them and helping them to clarify what can they claim in their country, what can they put on the labels of a product. I mean, this is very, very important to customers and for us as well, and we do the best to support them. So actually, we do maintain documentation, even a small database, which exactly contains this kind of information.
There's one more question that's come in from Naresh, and he says, Joerg, what's the period you would recommend? How long should astaxanthin be taken?
Forever. No, as I mentioned earlier, this is astaxanthin is supposed is thought to is used to support our health. Therefore, it is recommended to take this as long as possible. If you consider taking astaxanthin during a health crisis, let's say okay, then maybe you may want to start with a higher dosage. But if your target is to maintain general health, to boost or to support your immune system, then I would take it as a daily supplement for forever, for a long time.
All right, that's good. I mean, so start on and stay on with it forever. And one final thought process, which I thought is important to Fuji in you. One of our participants here has asked a specific question. Yeah. What type of algae extract is Astareal astaxanthin? Can you please enlighten us on that?
Okay, what we do is, so we have, so the most commonly used source of astaxanthin is coming from algae material, and this is the most productive algae is Haematococcus pluvialis. So we are growing this algae under strict hygienic conditions. We are unlike other companies who are using open systems like open pond systems. We are using state-of-the-art photobioreactors. So that means we have full control over the growth conditions. We can control temperature, pH, light, nutritions, and most importantly, we keep contamination out. We have no problems with cross-contamination with other species or bacterial infection. We don't have this. And this allows us to produce astaxanthin in a biomass with a constant high quality. So what is very important when you are growing Haematococcus and extract astaxanthin from there, you want to have the cells at the point of harvest. You want to have them all in the same high or the same mature status. So by controlling really exactly the growth conditions, we can make sure that when we start harvesting the cells, that each cell is mature. So that means that basically all the chlorophyll has been converted into astaxanthin. And this is very important because if I have a mixed biomass of a mixed maturity, then I have also a lot of residues of chlorophyll and the degradation products of chlorophyll. And they, in the end, when I have the finished astaxanthin product, they negatively affect the stability and the stability and the quality of the product.
Thank you. Yeah, Pankaj, please come in. Yeah.
No, KK, I have a question for you. See, what is the attractiveness for a pharmaceutical company when selecting an ingredient?
I think it was well covered in what was said earlier on also. I think particularly one were to look at it from an immunity perspective. Okay, today, as we just now discussed, that is what is on the front burner for everybody. How do we kind of address immunity? And that's true across the food companies, the ingredient companies, and also pharmaceutical companies. Today, in the last 6 months, we've probably seen so many pharmaceutical companies introducing a lot of immune boosters and stuff like that. And you yourself said, Amit, that, a lot of doctors today have made immune boosters a very important part of their prescription processes. So, and if doctors are going to prescribe that on an ongoing basis, quite obviously, pharmaceutical companies will be interested in launching more products in that segment, right? Because the name of the game there is prescriptions. And once you look at more and more products, you're going to look at newer ingredients and combination of several ingredients. And that's where I like what Joerg talked about. May not be one ingredient, maybe look at a combination of ingredients across nutraceuticals and minerals and several other aspects, natural products, combine them together. That probably gives you a product with a significant value add. So yes, I think there's a lot of attractiveness in that segment. It'll only increase as we move along. Right?
Glad. I was just validating it from a leading pharmaceutical company saying the same. Good.
No, absolutely, absolutely. So, okay, ladies and gentlemen, that's it then. And, it's often said prevention is better than cure. And ironically enough, please permit me to say that over a period of time, that statement, prevention is better than cure, probably gotten to be a little bit of a cliche. But if ever that cliche was ratified and it assumed magnified importance, it's today. And as one of my friends here said, because of COVID-19, probably the importance of immunity. If one talks of prevention is better than cure, one of the pathway forward is definitely by building immunity in the average human being across the world, and particularly in our country and in this part of the world, for sure. And if one were to look at immunity, the presentation today on astaxanthin was quite a revelation. Joerg Schnakenberg, thank you very much for that presentation, and touching upon several important aspects of astaxanthin. I'm sure a lot of people, a lot of participants here, you've gotten them thinking now as to, so what's my next step towards astaxanthin? And you were also very clear that let's look at astaxanthin maybe as a single ingredient or in combination with nutraceuticals and minerals and several other supplements and arrive at something for the future, because the future is to build immunity. And that, to me and to all of us here, is a no-brainer at all, right? On that note, that immunity will be the target segment of discussion, implementation, and action. And that's a no-brainer. Amit, would you like to come in for your closing remarks? And if you have anything to add to what's been said, please.
Sure. Thanks a lot, KK. And by the way, you're an amazing talker. So,
thank you.
KK, thanks a lot. And Dr. Joerg, it was very enriching information and lots said on immunity. But I would also want to highlight that no more random claims of ingredients. The next growth of nutraceutical industry is going to be responsible nutrition, clinical studies, proper clinical studies, validation, clinical proof is the way to go. In fact, just to tell you that regulators and governments are getting stricter. In fact, Government of India recently rolled out phytoactive Ayush ingredient clinical trial on 10,000 police personnel. So they're scaling it up to 1 million. So that is a clear message to the industry that no more holidays. You have to have a clinically proven ingredient before you hit the market. And that said, I think the pathway is clear. It's a matter of time now. Pandemic has accelerated it. And some good companies who have been investing a lot on R&D would certainly make a best out of it. Fuji has been conducting a lot of clinical trials, and what got interesting, and with this I'll close the session, is in one of the studies that they shared with me, there's something alarming that I found out. Sarcopenia, which was always an indication for geriatric population, the needle pointing to the geriatric has incidentally started moving to the mid-aged population, and that's serious. That's concerning because, it could impact the productive population of the country, and it could potentially impact the economy too. And I would, in fact, in near future, like to invite Fuji to talk on impact of astaxanthin in sarcopenia, because that would be, over and above immunity, and as immunity starts settling down, sarcopenia is one area I think one should seriously look into it and not take it easy. And I hope people don't wait for yet another, dramatic thing like pandemic to hit in the form of sarcopenia.
Yeah,
Amit, if I may just come in over here, I think as you're winding up, Pankaj just pings me to say that Fuji has a long-term safety study on astaxanthin. Pankaj, would you like to come in and say a word about this? Because one of the participants just asked, how long can astaxanthin be taken? And towards that, what you just mentioned over here, long-term safety study may be very important. So Pankaj, would you like to just come in and say a word about the long-term safety study, please? Amit, if you don't mind, I just thought that's very important.
I'm sorry.
Very rarely
I
does
just
one
saw
see
the
a 1 year,
question
1
that
year
somebody asked
real-time safety study is very significant. Yes, Joerg, you wanted to say something.
Yeah, I just wanted to add to Pankaj. I mean, for Astaxanthin, it's also very important that the ingredient is safe. And we have been doing a lot of studies and also collected a lot of information. And by now we have a kind of database, safety database, that shows that dosages between 0.5 and 45 milligrams of astaxanthin per day is safe. And in terms of length, there are usual clinical studies that they take a couple of weeks, let's say 3 months. But we have data going up to 2 years, where people were supplemented with, I think it was 8 milligrams per day over 2 years, and none of these studies reported any adverse effects. So I think this is pretty good evidence that astaxanthin can be safely taken over a longer period of time.
One of the point I want to mention that in India, regulatory status of natural astaxanthin is 4 mg per day. And here we have a safety study up to, as you mentioned, 45 mg per day. So here we're talking about even less than of the 10% what we have with the highest doses of safety study. And we are pushing with the regulatory body here, take it up to 12 mg per day so that we can cover more health benefit with natural astaxanthin.
Sure, thank you, gentlemen. Yes, Amit, now finally over to you to close this session. Thank you.
I'm good. I've expressed in fact, I'd like to invite Pankaj Fuji to take a session on sarcopenia in the near future using astaxanthin. But amazing session, and I look forward to, there's a question someone asked, why doesn't Fuji go to FSSAI for increasing the dose? I think Pankaj and Nutrify India have already represented at FSSAI, and hopefully we should have something going over there. But that's it for now, and thank you very much for your time. It was really meaningful session. Very soon the video will go live on Nutrify India channel with a lot of snippets that if in case you may want to promote it in your social groups. Thank you so much.
Thank you, ladies and gentlemen. Thank you very much.
Thank you very much.
Bye-bye.
Bye-bye. Stay safe.